My name is Richard Bockman, and I'm the chief of the endocrine service at the Hospital for Special Surgery, and I'm also a professor of medicine at Weill Cornell Medical College. Basically, the hormonal systems regulate a number of organ systems. My interest is specifically in bone and mineral metabolism. The usual conditions that I treat are patients with low bone mass, osteoporosis, or a common term is osteopenia for people who perhaps don't have frank osteoporosis. Some of the patients are a little surprised that we do request a number of tests. They call up to make an appointment and they're suddenly given a long list of things that we would like them to do before they come. This makes the interaction or the consultation much more efficient, and therefore we can move forward much more quickly towards our goal of deciding what is the appropriate agent to use depending on what the tests have shown us as to whether the patient is breaking down bone at a very fast rate and we need to use something to preserve and protect, or whether they have a problem where they just don't seem to be making bone well enough, fast enough, in which case we would have to use another type of agent. It's actually quite pleasurable to let patients know, one, if they do have the misfortune of breaking something, that it will heal, that osteoporosis doesn't mean that they don't heal their fractures. It just means that they're at greater risk for it. And then the fact that there are ways of dealing with this and making the situation better is actually quite liberating for a lot of patients. Hospital for Special Surgery it's a unique place because we have such a number of people who are totally dedicated to improving skeletal health and function, okay? And there's just the right and perfect mix of people who do it from a very basic scientific point of view and people who are interested in basically the health of the skeleton, and they integrate very well with the people who are actually fixing skeletal problems physically.